Hi everyone, this is Alex Theodorou, and you're listening to the Startup Sit Down.
Hey everyone, I am here with Annemarie Lankhorst from, we worked in many capacities actually together, and so really excited to have her on the show today. Annemarie is she was from the Netherlands and now is in Sweden, correct?
Yes, that's correct.
Amazing,
yes.
Amazing. And Annemarie and I have known each other for quite some time. I was actually one of the first users of Neurofit with our international partners. And so, we really had an exciting kind of time working together in the middle of effectively COVID and trying to find ways to bridge this digital divide between patients, professionals, and so I'm going to let you tell us a little bit about yourself, Annemarie, and let us know about maybe how you became a physiotherapist or what made you want to become one.
Well, thank you for having me, firstly. I am from the Netherlands, that you mentioned. And I'm currently living in Sweden now for a year. And maybe you hear it also, like, it's quite difficult for me to speak English at the moment because I had to learn my Swedish. My English is a little bit rusty, but I'm going to do my best today. When we met each other online, I was studying psychology in Belgium, and I was a physiotherapist in the Netherlands. And when I was done with my education, I moved to Sweden. So it's a bit of a journey. And I'm now working in Sweden as a physiotherapist in a large organization, which is a public healthcare organization. And I've been a physiotherapist for 13 years now, and I'm working a lot with patients with neurological disorders like stroke and Parkinson's disease. And now I work in Sweden. I see basically all kinds of patients. So that's a little bit about myself and my
amazing. Yeah, no, that's amazing. And I was just going to say, and very impressive as well, as I've also witnessed the language learning journey, because you've gone from learning English and Dutch, and then going to now Swedish, and I'm sure there's a bunch of other languages that I don't even know just yet. Care to tell us what are the languages?
Well, I'm speaking more. I can speak a bit of Spanish. I can understand French, but I have not practiced, so it's difficult for me to have a great conversation, but I can understand it. And I can understand German also, because here in Sweden, we also have a lot of German patients. So I'm having different conversations on a day. Yes. But it's cool to learn other languages. And I think it's also important if you can communicate with many people.
Yeah, absolutely. And I think when it comes to healthcare too, right? I think it's amazing that you're able to really connect people in ways that, is really unavailable for most, professionals, right? Like, when you go to places, it's assumed English. And I know that you had effectively 1 year to learn the language to a competency that you needed to be able to help people and work with them in a healthcare capacity. So I can't imagine that is easy. But what I'd like to know actually a little bit is, like, what has been the experience coming from one place to another, learning the language? How has been the therapy experience for you? Have you noticed any differences, as we come out of COVID and kind of trying to get back to what was initially the way we approach things? Have you noticed any differences?
Yes, I think in Sweden, I've noticed that people have more distance to each other, more than in the Netherlands. In the Netherlands, we want to shake hands, and we are a bit more close. But we're not allowed. So that's a bit of more of a struggle in the Netherlands than in Sweden, because in Sweden they're used to have a little bit more distance. For example, when you look at a bus station, people have a lot of distance between each other. And in the Netherlands, they want to stand close to each other. We don't have a lot of space either. So that can be a reason. But in healthcare in general, I think here in Sweden, people are really glad when they get treatments, because they have to wait for a long time to see a doctor or a therapist, because we have a lot of, we have to wait a long time. How do you say that? We have a waiting list. So when we do see a patient, they are really thankful and glad we can help and listen to the patient. So that's the difference. And they're really willing to do their exercises, which is very good for me as a physio.
Yeah, absolutely.
Yeah. So that's the difference. But on the other hand, with the languages, I remember when I just started as a physio in Sweden, I told the patients I do it for Swedish. I said to the patient, "Byta ben," which I meant you have to switch from one leg to the other. But what I really said was bite your leg. So I didn't understand there was a difference in the sounds. So that was a little bit awkward. So I had those experience a lot in the beginning. But,
that's amazing.
A bit more practice, but they understand the context. But sometimes it's awkward. Yes.
I could see the languages fighting with the English right now as we're talking. Yes. But it's I mean, how would you describe as the do lots of people speak English there, and what's like kind of the acceptance of like other languages other than Swedish? Like, what are you finding?
I think the younger Swedish people, they're brilliant in English. They're perfect. And they say, "Oh, I'm sorry, I'm not so fluent in English." And I think, wow, you're amazing. So that's the difference. But the more older people, they're not so fluent in English. Because yesterday I also had one patient, and I printed out like information on a disorder, and here are some exercises in English, and she said, "But I'm not really so good at reading English." Okay, we'll try to translate it. So yes, and she was really that old. So, and we have a lot of refugees from Iran, Iraq, Afghanistan, and they didn't learn English on school. So I have to translate it to many languages. So it's not easy in this region, I noticed.
That's amazing. That's amazing.
Yes.
So much to consider. But what I'm interested about actually as well is, so you've been to many places around the world. You've traveled quite a bit. You've learned these languages. You've seen healthcare during, before COVID, during COVID, after COVID. You've seen kind of the experiences of the patient experience. What is the role of technology in practice now? Do you notice that it's different from the Netherlands to Sweden? Have you noticed any differences in how they use or embrace new technology? How has that been?
I think there are not many differences in how they embrace technology. It's more the capacity and the financial opportunities they have, and the way the system is organized, how fast they can implement those technologies. Because in Sweden, it's all public healthcare. And so you have one organization and a couple of different provinces. Some organize the healthcare system. and it's regulated from the top, from the government. So it's a very large organization. And when you want to implement technology, it's really important in Sweden that everyone has the same rights and is treated the same way. So it's also for the so all the different, how do you say that, different games and what everybody wants must be implemented. So that takes time. And in the Netherlands, it's more private regulated, especially with the physiotherapy, and all the different hospitals have their own system. So it's a little bit easier in the Netherlands to implement new technology. But I think both countries are working on it on the same way. But it's a matter of how fast can you implement it and how much money do you have to implement it. So that's
Right.
I think, but not the motivation and the enthusiasm to work with it.
Yeah.
Yeah.
Yeah, and you mentioned that there, are obviously some financial considerations and constraints that, obviously these providers have to face. But what would you say has been like the reason, like maybe give us an example of something more recent that you're using in the clinic, and tell us a little bit about how was that coming from, to get it in the door, using it, what was that like, that journey going from new to, kind of working it into the system, and like how were the therapists' reactions to this new technology?
Yeah, I think that's quite an interesting one, because we have now, you can contact us through an app, and so we have digital meetings. That's possible. For some patients that's really wonderful, because the fuel is really expensive and we live on the countryside, so it's costly for them to travel here. So that could be an argument. We have people that are a little bit younger and don't want to get off from work, so they do a meeting in between your work. So that could be an argument. But we also have a lot of patients who say, I would like to visit you and see you, because they have so little healthcare and they just want to be heard, and a patient that they want to have a little bit of attention and how you say it, research, but like examination. Yeah. So they're not, and we just have a test online. They want hands-on treatment, really. So that's the maybe that it turned around a little bit. That first was everything online and they were afraid for COVID and get infected, and now they think, but now I want a decent examination. I have my complaints for a long time. Now I want them to look at it. So I notice now it's a bit like that also. So there are different aspects, I think. Yeah.
Yeah. And so I guess what you're saying now is that people had the virtual, they had the remote experiences, and now they're saying, well, I don't want to be only remote. They want to be in person. Do you think that there's an opportunity for the virtual in Sweden right now? Or do you think it's just they don't like some places, for example, have made what's called hybrid. So you have like some virtual, some in person, and then, some mixture of both. And so, so I guess what would you say is the structure here? Is it more only in person? Is it mixed? Is it, is virtual kind of dead, so to speak?
For us in the countryside, it's not even 90%. 90%. So we meet mostly here. and 10% is online. But in the city, it's a lot higher, the online, the digital meetings. But I think also there it's because people are more younger, more work, and here more elderly. So I think that's also a reason why it's lower here. But I think it has a future, because now in Sweden they're developing like a medical system which is available for all the healthcare providers and the patients, like a center-based medical file. And so we can add a lot of technologies to the system, and so it becomes more effective and more, like what you do with Neurofit. You put sensors on the screen so you can monitor motion, and like it get more developed and more implemented. And I think it will be used more in the future. But now we have to wait for the development to integrate everything. I think.
Yeah, absolutely. And how did you feel? Like, I mean, I know you were, one of the first to use Neurofit with patients, and I know it was, for some of the older individuals, it was more of a challenge, and for some others, maybe they needed different types of questions answered. But I guess what I'd like to hear a little bit was about, like, how did you feel it was like trying to bring the idea of Neurofit to, the clinic at the time? And this was in the Netherlands, right? Like, how was it? Did you find that there was a lot of resistance? Were they, understanding of it? Like, I was just curious about what happened between the time of, who is Alex and what is Neurofit to, okay, we'll try it out, and, and then continue to use it, for quite some time.
Yeah. Well, I'm really theory based and quite enthusiastic. So I'm always trying to convince other people with theory and good arguments. And I think my enthusiasm helps. So in the beginning, there wasn't really a lot of resistance, I think, because they liked the idea that we can train both the physical part and the cognitive part. Because in the Netherlands, I worked in a private clinic with a lot of people. I think there were 80 Parkinson patients and a lot of strokes and MS. So we had a big population of neurological patients, who almost all of them had like cognitive problems as well. So they really liked it, because they meet the physiotherapists quite regularly, but not like a psychologist or a doctor. So they thought, well, but that's a good idea, because I have to wait a long time for a psychologist and I can't train my cognitive skills. But when we can train it all together, it will be perfect. And it's more like a game mindset. So it's more challenging, because if you have therapy for a long time, twice a week, it can be a little bit boring also, even though we try to make it so as much fun and challenging as possible. But even though so they were really excited by it, but I think some patients didn't understand that they had to do it on a computer, because they're more iPad focused. And for them, for some patients, it was quite challenging to use a mouse or even start a computer. So they needed a little bit of for some, but others were quite exciting, and they kept doing it for the most part. And when they stopped using it, it was on private reasons and not really because they didn't like it anymore. So
Yeah.
Is there an answer to you?
No, that's no, thank you. No, that's great. And I always love hearing kind of the behind the scenes of what happened before, because we only see it. I'm on this side of the world, and you're over there, and I think there's some types of experiences that get hidden away. And so, no, that's amazing to hear. And yeah, I think you've definitely been a champion with technology, with innovation, and with just creating better patient experiences. So I think it's amazing, and I'm glad that you're in this profession and helping others, because I think a lot of people need to be thinking the way that you think about physiotherapy and helping individuals. But what I'd also like to hear too is just, what do you feel is missing right now from the physiotherapy experiences? Do you feel like there's something that you wish that could be done? Not maybe from you, but like just the industry. Like, is there anything that you feel is lacking or not all there? Or is there anything there that kind of that you feel needs more support?
Oh yeah, that's a big question, Alex. How much time do you have? No, I'm just joking. But yeah, I think on itself, like technology is endless in its possibilities. But to begin with, for me, and I think for a lot of healthcare professions, it's quite difficult to get an overview of what there is on the market, because there are so many providers and there's so much technology and there's so many articles about VR, about augmented reality. There's so much going on, fancy glasses, even contact lenses, or there's so much. And it's sometimes quite difficult to get an overview of, okay, I've got a patient and I want to train this. Which technology can help me? And so you have to update all the time with going to conferences, reading up. So I think that's it can be overwhelming sometimes. So that's my first but what I would like to mention is the accessibility, which is missing sometimes. And that's also quite general, I know, because I mean it in two different ways. Because firstly, when I'm talking about accessibility, it's like, when you have a website, can everybody read it? Because when you have visible disabilities, it can be hard for you to read it. You need another way of getting your information, and when you can't hear the sounds of a video, for example. And so are there a couple of things you must think about when you develop technology. And on the other hand, I think it's also important with I've write it down now, I forgot it. Oh yeah, the language is important, because I've noticed now that a lot of patients can't speak English, and then it's quite hard for them to do the exercise and understand what they have to do. It was the same with Neurofit. There were patients that didn't understand the language, and I had to sit next to them and tell them all the time, oh, now you have to do this, or now you have to do that. Because when they tried it at home, they didn't understand and they were frustrated. So they didn't want to do it anymore.
Because it was in English, right?
It was in English and they didn't speak English. But I noticed here also that, when I give a patient English exercise, they don't understand. They're not doing it. So, I have to translate it all the time. So it's important that it's available in many languages. It's also difficult to use a program which is best for the patient without having 20 other different contracts with organizations who provide technology. Because I had a patient like 2 weeks ago, and he had an accident and he had brain concussion and difficulties with concentration. And I think, which program can we use to train your concentration? And that's sometimes hard. Sorry. I keep
Okay.
talking Swedish. And what my dream is that we can combine all the technology, and we think out of the box. We can combine all the different possibilities which there are right now, and like we've talking about it also about the virtual reality glasses, that we can combine more the cognitive with the motion, and that we have motion sensors, so we can register the movement of a hand, and so they have more like a functional game, because it's really important that everything is more functional, because the more functional it is, the more successful a therapy is, really, because they're going to do it also in their daily lives. So combining everything so it's more functional, so you have more results. So that will be very great.
Yeah, no, and I appreciate that. That's wonderful to hear, and definitely sounds like you've seen what works, what doesn't work. You've kind of recognized the needs of patients, but also what are the needs that they, how can we better support them moving forward, right? Because there's a lot of, it's not just about helping them today. It's how can we help them so that they can apply those skills beyond the therapy or beyond the sessions that you have together. And so I think that's really important. So I am amazed at the work you've been able to do, Annemarie, and I'm sure that your patients are thankful for the amazing experiences and your willingness to kind of take new technologies, new experiences, and just use them to help create a much better patient outcome. So, and I think that's the most important thing that we're all trying to accomplish here.
Yeah, that's really great. And I think there's a big future for the technology. But it's really important that we don't forget the patient and what's best for the patient in the first place, and that we then see, okay, what do we need? How can we offer it for the best matter? Can you say it so? No, it's I'm thinking in Swedish now. It's quite difficult. But what I mean is that we have to be patient-centered, and then see what do we need. And it can be a digital service, it can be hands-on, it can be just listen to the patient, it can be all sorts of things, it can be virtual reality, but listen to the patient and see what they need first. Because it's, for us, it's quite exciting with all the new technologies. And when we have a new tool in the gym, we think, are we going to try it on all the patients? But sometimes we forget, but what does the patient need? Because we are so excited by it. So I think that's important to keep in mind. Yeah.
Absolutely. Well, thank you so much, Annemarie, for that amazing insight and perspective. And I'm glad to have been able to play a small part in the journey of therapy for individuals that you've worked with. And we'll definitely love to stay in touch and learn more about the work you're doing and the impact that you have over there in Sweden, and I'm sure the lives of many people around the world. So thank you, Annemarie, for coming in, and take care.
Yeah, thank you. Have a nice day.
All right. You too. Bye.
Thanks.